And we're joined now by the co-chairs of the Congressional Mental Health Caucus, Republican Congressman Tim Murphy and Democratic Congresswoman Grace Napolitano. Congressman Murphy, as a man who spent decades working as a psychologist before coming to Congress, what questions do we need to be asking about our mental health system in the wake of the Newtown tragedy?
Well, there's several. First of all, we have to get America focused on understanding the mental health issues involved with this. For too long, we've ignored it. We've pretended it's not an important issue, or we've talked about it in a very cursory way, and then we've stopped. That involves a lot of public education, understanding the issues of mental illness today are not what they were 20 or 30 years ago. We understand more now about the neurobiology aspects, we understand more about treatment aspects, medication, and we need to be addressing those. Another aspect is, when it comes to the federal government, we need to be reviewing what we do. Do we have enough funding in the areas that can help people get treatment? And is that being used effectively? Not only in the treatment aspects, residential care, community care, outpatient care, but in research as well. There is still a great deal we need to know about understanding the mind of the violent person. We have a long way to go on that as well. So there's several aspects of this with regard to mental illness we continue to pursue.
And we want to get deeper into those issues here for the next hour or so in this segment of the Washington Journal. We're taking your calls on this issue. The numbers for the Republican, Democratic, and Independent lines are up on the screens, and the phone lines are now open. Also have a special line in this segment for mental health professionals. Mental health professionals can give us a call at 202-585-3883. Congresswoman Napolitano, I know details are still uncertain about what happened up in Newtown, but from what we understand so far, do you think our mental health system could have or should have been able to prevent this or play a role here?
It would not have, simply because there isn't enough out there to be able to help the parents. I can tell you of instances where families have tried to get help from the school districts and there's none available because there's no funding. And the general public is not informed and educated, as my colleague was saying, as to what some of the symptoms are and how to address some of these symptoms at an early age. So we started a program about 11 years ago of mental health delivery in schools. And I have a bill that I'd have no Republicans on it, the Mental Health in Schools Act, to be able to put on-site services, clinicians, to help the children, the families, and the educators. We do need money, funding. We do need to be able, instead of closing hospitals, instead of putting funding in other areas where we need to help our children grow healthy and be able to learn in schools and help the educators be able to teach because they're not dealing with children who are misbehaving in classrooms. There's many aspects to it, and most of them are youngsters who have done these tragedies, young men who have had a background of mental health issues.
Some stats on adult mental health in the United States in 2011. This from the Substance Abuse and Mental Health Services Administration, about 45.6 million with some form of mental illness, 11.5 million with serious mental illness. 8 million had substance abuse disorders in 2011. 8.5 million had serious thoughts of suicide, and 31.6 million Americans received mental health services. That's just with adult mental health. On youth mental health, that's ages about 12 to 17. This also from the Substance Abuse and Mental Health Services Administration. About 2 million had major depressive episodes. 36% of those used illicit drugs. 18% had substance abuse disorders. 3.1 million youths received counseling for treatment, and the most common reason for youth mental health services was depression. Congressman, back to you. What are the major federal health care programs right now that our taxpayer money is going for, and how are they used in this area?
Well, that is something I'm actually calling for a full review among all the programs under the Energy and Commerce Committee and others. We need to list every one of them. There are programs within the Department of Justice and prisons. There are some things in the Department of Education, as my colleague was saying, not enough. There are programs under Health and Human Services, and there are things that deal with housing. There's things that deal with non-residential care. We throw a lot of money at this. I want to make sure these areas we're not going to see cuts in as coming up, but the key is we have to make sure they're effective. And this is where Congress can play a vital role to say we want all these listed. We want a thorough review of where that money is going. Is it being effective? Is it really getting to the level of treating the patient? or is it caught up here in Washington, D.C.? None of us want to see that. I mean, we're not doing any good if it's just taking care of some office space here. It needs to get out into the community. But even more so, we ought to make sure we're doing a thorough review of the laws the federal government and states have. Let me give you an example of a barrier to this. In Pennsylvania, well, every state has some laws that deal with someone being voluntarily or involuntarily committed. In Pennsylvania, however, if you're over age 14, you can sign yourself out. Now think of that. 14. There's a lot of things we don't let kids make decisions on when they're 14, let alone 16 or 17. At age 14, if a parent say, my son or daughter is pretty dangerous, I can't handle them in the home, I need them to be in an institution or a hospital, psychiatric hospital or something, that 14-year-old can say, I don't agree, and I'm signing myself out. It then has to require a court procedure to keep that child in the home. Now, in my years of treating children who have anger disorders and assaultive disorders, there's times when a lot of these kids have a situation where their parent is literally scared to death about them. They lock themselves in rooms. The parents do. The parents may lock themselves in the car. Parents who have taken knives out of the home. Parents who take guns out of their home because they're concerned about these kids. They try and get them in a hospital setting. But if that child's over 14, it is nearly impossible in Pennsylvania. Now, another aspect of this, too, is that when it comes to dealing with danger, you have children who are in households with this, and parents just are feeling immobilized. That even if they try and get the child in care, they have trouble. And Connecticut just turned down a law which would have tried to make it easier to have some institutional care for these kids. And these are all serious problems.
Well, Congresswoman, the Congressman said he wants a list of what all the federal mental health programs are. More immediately in these fiscal cliff negotiations, are we seeing cuts potentially for mental health programs, and what can be done in the next 11 or 12 days here?
Well, there have been cuts, and we sent a letter just not too long ago to have cuts, no cuts in one of the programs. Which
the two of you together sent this letter?
Yes, remember it was a joint letter. The problem is that they don't consider it one of the priorities. And it's unfortunate. There have been $4.5 billion cut in the last 4 years from states' grants for mental health. That's unconscionable, because they're the ones who are at the front line trying to help the cities be able to manage some of the issues they have at their own backyard. And in California, we had that proposition, the bond bill that passed. So there are more services available for those that need mental health, but there's still not enough. We need to start at a very young age.
These cuts that you're talking about, who's been pushing these cuts? Where are they coming from?
Washington.
We
Federal
also
government.
have with that, too, if the sequester kicks in as it is, there'll be further cuts to that.
Correct.
And this is where we have to make sure, as Congress, we finally have an open, honest, and thorough dialogue on this. To say that you just cannot have automatic cuts on these things. Look, we're willing to look at ways to reduce government spending. We recognize we have huge deficit problems. But perhaps, if anything, this situation has woken us up to understand that we have to look at what programs there are they effective and what level of funding they need to be more effective.
And how do you keep your members of both parties engaged on this? And
you can't. They are not listening. We can't get. I had a briefing just recently with the Department of the Navy to come in and talk about the PTSD and TBI for veterans and for their servicemen and women.
Post-traumatic
He was the
stress
only one that
disorder
came.
and
Correct, TBI, traumatic brain injury.
traumatic brain injury.
We maybe have
Tim and I,
staff.
correct. And you send the word out repeatedly to people. This is important. These are our men and women in our district. And yet, it is a stigma. It's still, and we need to erase that stigma. We need to say, we need help for these men and women. And then, you help the economy. These people then get services, and you will now have people to be able to work, able to function, able to take care of families, and we're not paying attention.
We're taking viewer calls on this issue. The lines are open. We've got a special line set up for healthcare professionals. One healthcare professional calling in is Joseph from Florida this morning. Joseph, you're on with the co-chairs of the Congressional Mental Health Caucus. Good morning.
Good morning. Thank you for giving me some time. I worked in New York City for about 28 years as a bilingual teacher and a certified guidance counselor. If I could just give my personal testimony, I think it may be relevant to the issue here. I studied at Hunter College, City University of New York, for a master's degree in counseling. And that master's degree at that time required only 30 credits, graduate credits. I was in the last class that was certified at 30 credits. Afterwards it became 48, and now I believe it's 60. Well, my training, I thought, was quite good. We had very experienced, talented professors, and the objective was to put on the front lines some trained people to basically just be listening, have disturbed children referred to us, and that we had enough training that we could try to help them, or if we felt that the problem was severe enough, we could refer them. We had psychiatrists in New York available, school-based support teams, and I'm now working in Florida as an adjunct professor at the college level. My feeling is, and I don't want to be too judgmental, but I think in the community college level and maybe colleges in general, I don't feel that the staff, the counseling staff, feels more or less the responsibility to really help these disturbed students. They would just as soon see them just leave or be dismissed or whatever.
Congressman Murphy.
And this threat.
Yeah, there's he's bringing up a very important point. And this, let's look back to the Virginia Tech shooting, which is the biggest,
deadliest
shooting to date. There's a ruling out there, the FERPA, the Families and Educational Rights and Privacy Act, which was developed years ago when students were seeing their grades posted on a bulletin board. What we worked on in Congress, remember, was the issue of saying that if a student is a threat to themselves or other people, that colleges and community colleges, et cetera, were saying, gee, we don't want to breach confidentiality and tell anybody about this. So in many cases, you had faculty, administration, therapists aware that a student had a problem and didn't do anything about it. Now, sadly, the most common aspect of violence when someone is mentally ill is suicide. These other cases are rare in the mass casualty attacks. But we worked to get some wording and clarification in the Department of Education to clarify that. I'm not sure if it goes far enough, but it's sad when you have universities and community colleges, et cetera, who are more concerned sometimes about being sued than getting help. But he's bringing up a very good point. In many cases, when you have a student who may be at risk for violence, they're alienated, they're alone, they have other disturbances, people may start to see signs, but they don't speak up. This is, again, one of those places where we can't have this stigma. This dialogue needs to be occurring within campuses, whether they're high school, primary school, or on the collegiate level, to be talking about getting these kids help and informing the family.
Congresswoman,
the problem there is that the families don't know sometimes that the child is having problems. So if the faculty, if the university, college is able to connect with the family and let them know that something is wrong from their standpoint, to help that individual family member be able to get some support services somewhere, is be able to be there for them and not just keep it to themselves with fear of retaliation by a suit.
Well, a Health Day story that came out this week in the wake of that shooting noted that parents sometimes find it tough to admit that their child has mental health issues. Talk a little bit through that, advice you'd have for parents if they are seeing some of these signs but don't want to admit it.
Well, generally, we want people to know what the signs are. So we've been trying to put out information on what some of the signs, beginning signs, and then be able to ask for help. The idea is, especially in the Latino culture, we don't speak about it, we don't talk about it, it's a stigma, it's a macho thing, if you will. And we're saying, look, if you have a problem, if your family has a problem, if your child or your spouse, ask for help. Go to your church, talk to an individual who may be able to give some counseling and be able to help out. The unfortunate part is there's big stigma for decades. And it's not going to go away until we realize that there is help for a lot of individuals and that we need to be able to bring it out more, to be able to get assistance and be able to address these problems early on, especially even at a grammar school level where teachers tell us they can begin to spot some of the disorders.
Well, Congressman Murphy, Joseph Ramirez writes in on Twitter, was there evidence that Adam Lanza, the shooter in Newtown, was mentally ill? I know details are still coming out. You're the co-author of a book about angry children and regaining control, regaining control when your child is out of control. What have you found out so far in this case?
Well, I don't want to get into diagnosis of until we have all the details on this. And there are rumors about, did he have Asperger's syndrome? Asperger's syndrome is not primarily associated with violent outbursts. Was the mother trying to get him in patient care? Let's wait and find out the facts.
And the vast majority of mental issues are not associated with violent outbursts as well, we should note.
Yeah, that's right. When you have drug and alcohol abuse and mental illness, sometimes that's a better predictor of things multiple times over. So that's another point. We shouldn't be afraid of these just because if a child has a problem and gets diagnosed, that the problem is not getting the treatment. The problem, denial doesn't work as a treatment mechanism. But in that book you referenced, we talk about a number of things there what parents need to understand. This is when you get help. The 10 traits of angry children. Many times they're makers of their own misery. They create problems in their lives where they behave. They have difficulty analyzing social interaction, emotional relationships. They tend to blame others for their misfortunes. They turn sadness and the bad feelings into anger. Very different mothers. They lack empathy towards other people. They will attack other people rather than solve problems. They will use anger to gain power and control over other people. They indulge in a lot of destructive self-talk. They'll get themselves worked up in a frenzy and talking about things. They also confuse anger with self-esteem, thinking because I'm angry and I have power over you, I know I'm better off. And yet they can be very nice and charming when they want to be. They're not totally bad all the time. And this is where parents sometimes think, well, my kid's okay in many other ways, so I don't need to get help now. But I tell parents, if you're at that point where you find yourself afraid of your child at times, you need to get help. And you need to make sure weapons are out of the home, and you need to make sure you're getting professional assistance, including medication, counseling, therapy, but inform people that you can't do this on your own.
Would point to a story that appeared in the Huffington Post, republished from the Blue Review. The headline, "I am Adam Lanza's mother, a mom's perspective on the mental illness conversation in America." Congressman, you're nodding your head. You saw this story?
It's a powerful story when the mother writes in there that she indeed was in a situation where she would tell her kids to go sit in the car and lock theirs. She would take the knives out of the home and lock them up. She knows what these angry children are like. And they can be incredibly overwhelming to families. There's a lot of the kids that I saw when I was doing therapy with families, and they're ones that I tell parents, if you are a parent of that kind of a child, you cannot handle this on your own because you're already feeling that way. Call for help.
Let's go to Sue from Marble Falls, Texas, on the Democratic line this morning. Sue, you're on with the co-chairs of the Congressional Mental Health Caucus.
Thank you very much. I haven't called in about a year, and this subject just screams at me. Both of these professionals, and they're doing a great job, but they are not mentioning something that I don't believe 99% of this country knows. It's an organization called NAMI, and it's National Alliance for the Mentally Ill. It's in Arlington, Virginia. It is the grandfather organization over mental health. And I met a lot of them in San Antonio, Texas, when I was doing therapy groups as a uneducated social worker with depression, but I've always worked in social work. And that's not the point. I'm sorry, I do ramble. NAMI could have as much influence almost as NRA if it worked at it. And I'm appalled when good professional people like this apparently have not been contacted or contacted them. And
well, Congresswoman, you were nodding your head about that. You know the organization.
I beg to differ with you kindly. I've been working with NAMI for a good 15 years when I was in the State Assembly. And they're part of my task force, which meets about every other week in my district office with about maybe 40 other professionals from schools and psychologists and some other folks. We work on the different issues, not only in schools.
What is that group's mission, just for those who don't know about it?
I'm sorry?
What is NAMI's mission?
NAMI's mission is to work with on the mental health issue. NAMI is very powerful. You're right. They don't exert as much of their influence where they could or should. And I take that because, unfortunately, I think it's, again, the stigma and the fact that they are not as well, I would say, organized in outreach and being able to get out into the different areas that are needed. I know them very well. I've worked with them, and they're wonderful people. There are many organizations that need to be able to work with NAMI and vice versa. They are effective, but we need to work at the local level in the schools. where the children and the educators are working with the youngsters, even at a grammar school level, where they tell us that they can begin to spot some of these disorders and be able to talk to the parents and be able to try to solve them at that early age instead of waiting until they get older. And that's one of the things that my school, Mental Health in Schools Act, does. It provides for grants and scholarships of $200 million, $1 million to each school district, to put on-site clinicians to help these youngsters educate the administrators and the teachers and work with the families to get to the bottom of what ails a child.
Congressman, the Congresswoman pointed out that there weren't any Republicans on that bill. Is that correct?
Yeah, you know, and this is where we need to rethink this issue. Certainly in the era of the last few years when people talk about let's not have spending unless it's offset somewhere else. I'm hoping that in the discussions going to take place in the next few months with regard to the automatic sequester, the cuts that kick in, we can really go line by line and say where do we need to do this. Plus, there are some areas of funding in the mental health field that come through several departments here, and I want to see, are we better off in some of those things that are not working? We can find some ways to transfer that money and getting into communities, and that's what we can work to find, how we get that money moved into the right effective areas.
Victor writes in on Twitter, mental health issues are like the ocean, vast. You can never have enough funding, but we cannot throw our hands up either. Up next, Jason is from Okeechobee, Florida, on the independent line. Jason, you're on with Congressman Murphy and Congresswoman Napolitano.
Yes, sir. Thank you very much. There are plenty of people in this particular county that I'm in that there are disabled veterans who are homeless out here in the streets, while mental health people who are self-inflicted wounds through drug addictions are younger than these disabled vets, and they're getting funded every month by the government to turn around and go get more drugs every month. And there's homeless veterans out here in this place. The government is paying these people to stay mentally ill. They're not getting help. They think their help is to run to the neighborhood and buy more drugs.
There's a couple of things about that. First of all, I also want to say, in addition to being in Congress, I'm also an officer in the Navy Reserves, and I work with post-traumatic stress disorder veterans, combat veterans at Walter Reed Bethesda Hospital. And one of the things that's happened from this event at the Newton shootings is I'm getting calls from a number of the veterans that I've worked with talking about how this has brought about for them a lot of serious memories and flashbacks because they have seen children in Iraq and Afghanistan who have been killed or maimed by Al-Qaeda and the Taliban in horrific incidences. And I want to speak out here to veterans out there. This is one of those areas where if you find yourself having those kind of feelings, call your counselor, get some help with that too. Those who are, I mean, there's programs out there to help homeless veterans, etc. We've got to have outreach to them. I know the Department of Defense and the Veterans Affairs has put more funding into this, but in every case it's a matter of being effective in the community. I'm not one to say that when you have someone who is in drug addiction, it's enough to just put them on methadone maintenance. The best thing is to get someone off of drugs. And we know for veterans that if they feel isolated, they simply go home, live in their mother's basement, playing video games, over-medicating, taking illegal and legal drugs, and drinking alcohol. That is not the answer. So this is another one of those areas we have to be doing more outreach. But also, if you know people like that, please encourage them to get help. Make links. If they're having trouble finding those links, one of the things that happens with the congressional office is we all do a lot of that, connecting people together. It's a sad story we cannot let happen.
We have a special line in this segment of the Washington Journal for mental health professionals. That's 202-585-3883. One of those professionals is Cynthia from Boca Raton, Florida. Cynthia, thanks for joining us on the Washington Journal.
Oh, you're welcome, and thank you for taking my call.
Go ahead.
One of the issues that is being totally missed is that the reason that people do not bring their children to schools for help is because they then get labeled forever. I am both a professional and a consumer of mental health services. And I have to tell you that it is almost impossible to find mental health services for people who are on, for instance, Medicare, where they don't have to add any extra money. I've had bipolar for 40 years. I've accomplished getting a master's in nursing, raising my child, running in hospitals, and yet I'm in a position of not being able to get the care that I know that I need. I've lived with this now.
Well, Congresswoman Napolitano, talk about that stigma issue that she brings up.
Well, and congratulations, Cynthia, for your accomplishments. That is remarkable. The unfortunate part is that you're very right. The services are not available for Medicare, for some of the Medicare recipients. And that's one of the reasons we wanted to be sure that we get mental health parity and inclusion in the healthcare reform, to be able to have the medical health care plans be able to provide those services, those additional treatments for people who need them. We've left this too long. The stigma is the biggest reason, because people who have problems, they don't normally vote like children, and those that are afraid to speak up and get help sometimes don't know where to get help, and they don't know how to identify what they're feeling to be able to know what to ask for.
Congressman, schools that label kids that have these issues?
I did my dissertation years ago on the aspect of labels, and does that have an effect on kids? And yes, it does. And does it help them get assistance? A label can be a lock, and that is, it prevents you if people feel you're now channeled into some area and you're not going to get assistance. But it could also be a key. And in this case, I said, let's opt for the key to unlock the doors of getting assistance. We have done some things in Congress. A couple of years ago, I pushed for a thing, and Grace supported it too, to change the copays with Medicare. There used to be very high copays, and you have a lot of retirees, senior citizens, who couldn't afford this copay. They weren't getting help, even though depression is a big concern for people over age 65. The Mental Health Parity Act we passed. We're still waiting for the regulations on that. We've got to get those out there so we know what's happening. And even so, it's in communities making sure there's professional trained. We still have a shortage of this, of people who are involved in these fields. And in part, if you don't have the systems and networks out there to support with also the connection between community services, school services, hospital services, there's still a lot of barriers there. But I don't want people to feel that because things aren't perfect yet, I don't want to get help, because we come a long way in identification and treatment of mental illness.
Congresswoman Gibson writes in on Twitter, how can we get mental health pros to start reporting these unstable people that they are aware of? As an example, the Aurora shooter.
Well, there's the privacy issue, and you can't just go out and blurt your names out with the media will pick it up and sensationalize it, and then that family, whether or not, or that individual, whether they're actually ill or not, is labeled forever. You have to be very careful, and you have laws that prevent us from being able to divulge. But I think that the schools and the communities have a responsibility to work with the individual families, or to set up a mental health clinic, disseminate information of how this can be helpful to people who, as my colleague was saying, I'm having a problem with my child, but I can't yet define he's okay the most of the time. But be able to go to a place where they can help identify if there is an issue with that child.
Well, after the Aurora shooting, and if more information comes out about Adam Lanza and there's a mental health situation, do we need to start rethinking these privacy concerns that the Congresswoman was just talking about?
There's a couple levels of that. One we talked about before was schools, and I think schools should be held harmless if they are acting in good faith. Two, mental health professionals and medical professionals are required now by law. We have a duty to inform and disclose. If we think we have a patient who is making threats, then or they're going to take some action, violent action, we have a duty to call the police and notify authorities. The trouble is, what happens if you're not sure about that? We gather information, and if the person says, look, I'm not going to hurt myself or anybody else, this is an area where we need a lot more research. This is an area where I believe the National Institutes of Mental Health and National Institutes of Health should be directing some of their research to say, this is an area we need to know well. I would certainly hope, and I've contacted the White House on this, says we should be part of this. This should be part of our national conversation. And don't just do it for a couple of days, but stay at this for months till we have some answers. But you're talking about a key component here, and that is, If neighbors and friends are also concerned about someone, it helps. I mean, call the mother and father, call the other folks. Sometimes they may not know, and if they do know, they may say, I'm exasperated, I don't know what to do. Thank you for calling me. Can you give me some ideas of what to do? There are times when we are best to show compassion to our neighbors.
If you're just joining the segment of the Washington Journal, we're talking with Congressman Tim Murphy, a Republican from Pennsylvania, and Congresswoman Grace Napolitano, a Democrat from California. They are the co-chairs of the Mental Health Caucus on Capitol Hill. Up next, we have Demarius from Leesburg, Virginia, on the Democratic line.
Hi, good morning. I might be a little off topic, but I think part of the problem of what's going on with these children is that I think that time that we gave the power back to them, when we can no longer discipline our children to the point where I think that we're doing them greater a disservice by not, I think we coddle them too much, and I think that it's really lending to a set of, I don't know, values, I guess, that I think we're disservicing our children. And I'll just hang up and take the comments. Thank you.
Well, Congresswoman, the caller touches on a point that political activist Ted Nugent raised in a front page editorial today in the Washington Times. He notes that in that column, some will argue that we don't have enough mental health treatment programs, while others will argue that we can't violate the privacy and civil liberties of the mentally ill. More laws and more restrictions won't fix our culture. The problem we face is much deeper and more insidious. What ails us is the spiritual bankruptcy of cultural values that actually matter. As with most things, the cure to this mess begins and ends with the family. Traditional family values have been under siege for decades by our culture of contempt. In the absence of a solid family, the whole thing slowly unravels and rots.
I think he has a great point. Because for years, and now decades, my children are in their 50s, and I was the disciplinarian. At school, I would tell the teachers to let us know, and I would discipline them, even after school. But we have become very lax with the children, and I can tell you I've seen many children in my work that the teacher can't discipline because they are prohibited by law from doing anything that goes beyond a certain point. Sometimes television has a part to do with it because everything's allowable. Whether it's drugs or promiscuity, all those things that has eroded a lot of our values, I think have an inherent part in how the parents then deal with their children. Somehow, we've got to go back and begin to understand our responsibilities to raise our children the best way we can so they can become good citizens and be able to function as we have.
Congressman Monty writes in on Twitter, is a mentally sick person a product of his home and surrounding environments?
It is both. There's a lot of neurobiology involved with this. There's a number of environmental issues. From the standpoint of parental values, it's also parental involvement. Many times parents will actually call a lawyer or someone else at the school, contacts the family and says, your child has a problem. The parents need to sit down with the school and say, what do we need to do here? And the school, on the other hand, shouldn't also find, well, it's all the parents' fault. But it's working as a team. But understand there's a lot of aspects of mental illness that even with the best of parents, they can be overwhelmed by them. We have to have this discussion, however, of parental involvement. What happens when fathers are not involved? And you see this in many cases as well. Sometimes kids will obsess on video games, and you see parents saying, well, I'm going to buy these things. And sometimes the best thing a parent can say is no. I tell parents, if you want your child to say yes to you, you need to say no to them. That is the aspect of discipline and understanding that if you have a child who is running the show and calling the shots and parents keep saying, well, I'm afraid, so I'll just keep saying yes in hopes that you're going to love me more, that's not the way we raise children. It's helping them understand and have a set of values, which Grace is saying here too. It's all very, very important. But even so, you can still have mental illness as part of that child, and that even with the best of parents. And I don't want parents to think they should feel guilty and embarrassed and not get help because they think they've failed somehow.
Again, Congressman Murphy is a co-author of The Angry Child, Regaining Control When Your Child is Out of Control, published in 2002, and also Overcoming Passive Aggression, How to Stop Hidden Anger from Spoiling Your Relationships, Career, and Happiness, that was published in 2005. William is up next from Reading, Pennsylvania, on the Republican line. Good morning, William.
Good morning. Good morning, Congressman, Congresswoman. Good morning, sir.
Good morning.
I want to give my condolences to the 20 people the little kids that got killed. And I'm 67 years old. I had 2 people raised. Hello?
Yes. Go ahead. We're here.
Yes, I couldn't hear you. And I'm 67 years old. I have two kids myself, and my daughter's 49 years old. But the point is this. We're going to have to stop getting involved and tell people how to raise their kids as government. And I'm involved with government. My wife is she was with the state 35 years, and the welfare department and all that stuff. And we give too much right to the government to tell you how to raise your own kids. That's the problem we have. And we always blame somebody else. We don't blame the parents. That's their responsibility to raise their kids, not the government. Mm-hmm. Your job is to protect us from anything it would take care of, crucify our country. That's your job.
I think we agree with you on that.
That's raise my kids.
Nobody. Government shouldn't be the parent. Government should be there to help in other ways, too, and to provide the kind of professional assistance that's needed. But it is one of those things that is part of this national dialogue of dealing with this. There's lots of levels of responsibility. There's things we can do in Congress, but we can't replace what parents need to do. And parents themselves can't walk away and say, well, this is someone else's problem. I can handle this as well. We're not going to get to a solution, however, if all we do is finger point and come up with a couple of things. Sometimes we think because we're angry, we must be right. And sometimes we think if we've done something, we've done the right thing. And this is where we have to really be very candid with ourselves. What's the role of parents? What's the role of television? What's the role of video games? What's the role of public safety and security? The role of schools? All of these things have to be discussed in this. And part of our ongoing frustration is these things keep getting pushed aside.
Right, and let me add that anymore, when I was growing up, we had a lot of discipline with our children. Mm-hmm. Anymore, it's gone, or it's very eroded. And there's many dysfunctional families, and they cannot raise a child by themselves. Mm-hmm. So it isn't us telling the people, the government telling the people how to raise their children, but it's helping them be able to be more effective parent.
Great point.
Congresswoman, why did you both start the Congressional Mental Health Caucus?
Well, I revived it when I first came to Congress simply because I was involved at the local level on mental health issues. I have Metropolitan State Hospital in my backyard. And I've been involved at the state level on mental health. And the reason is we tend to ignore the fact that the Mental Health Caucus was dormant. So I revived it, and when Tim came on, I asked him to join me because we needed a Republican and a Democrat to balance it off so we can get both sides involved in it. And the idea is to be able to raise the awareness, reduce the stigma, bring information not only to the members of Congress but the staff, because the staff is the one who helps the members be able to guide them into areas where there's more of the dialogue.
I would say if there's something that viewers want to know they can do to help, I would suggest they call the member of Congress and they say, are you a member of the Mental Health Caucus? And also say, can you tell me, is government funding effective in the programs that are out there? Do we have the right program? Is it getting to the community and getting to the needs? And if not, ask Congress to take the right steps to make sure it gets out there where it's needed. Because I know lots of Americans are deeply concerned about this, deeply concerned. And we all want to help and make sure we do everything we can to prevent this from happening again. There's two concrete things you can do.
And I may not have very many Republicans in the Mental Health Caucus, I'll tell you right off the bat. Many Democrats, but very few Republicans.
We'll work on that.
Margaret's up next on the Democratic line from Dublin, Ohio. Good morning.
Yes, good morning. My younger brother grew up without video games. We had a solid Christian family. He is schizophrenic and has been for 58 years. I'm a few years older than he is. We have begged for services. We have begged for help. There is no way he contributed to this society. He cannot work. He is totally medicated, living, excuse me. I totally and respectfully disagree with the Republican congressman who says with a needed accounting we can do a better job.
That's not what I said. No, I also said that there's a lot of times...
Excuse me. And what we can do is tell our parents to do a better job. There were no video games when my brother was growing
Margaret, let's
up.
give the congressman a chance to
say
respond.
That. Please listen. I said that I said many times you have parents who are the best of parents, but these problems still emerge. I named a whole host of things that can be done. Look, there's been a couple of shootings in my own district. One of them by a gentleman who was diagnosed schizophrenic, another one at the LA Fitness Center, and by another gentleman who had serious psychological problems. I'm not blaming this on the parents. I'm saying in these situations you do have mental illness that emerges that despite all the other things, the issue is getting them help. Now, here's what has happened in society. In a move to be compassionate, we shut down all the institutions and hospitals. Look, I understand we don't want to have those as warehouses for the lonely and the misbegotten, and they were misused that way. But there are many people out there who simply cannot function in society, and we need to have alternatives for them. Because they can't just say live at home and over-medicate them into a stupor. That is wrong. We need to make sure they get the help they need, but they need alternatives. We also need to understand that mental illness is something that can be treated, medication can be helpful. But what we've done is we've sometimes the only thing we offer parents, and I've had situations like this, and in that article you read about Adam Lanza's mother, that many times parents are told, you know, if your child does something wrong, we'll get them into a juvenile detention facility, or if they're an adult, we'll get them into a prison. Those aren't mental health treatment centers. They're not, and they never will be. But we're now turning those into the warehouses for the mentally ill. That's wrong. We need places where people with serious psychological disorders who can't function in society can go and get ongoing treatment and help so they don't become a harm to themselves or others. Please understand, I've never said and I'll never advocate that it's the parents' fault and if only they did things better. I'm saying all of us are in this together.
Some stats on closings for state psychiatric hospitals and hospital beds. Number of state psychiatric hospitals closed, 15 state hospitals closed, 4,471 beds. This is between 2009 and 2012, at a time when a lot of people were affected by the economy and perhaps seeking these services.
You talk to any of the law enforcement officials, the prison guards, and they'll tell you the majority of the people there need psychiatric help. There are so many that are just institutionalized without any assistance. They come out worse because they get no services.
Email that came in this morning, no name, and the email kept confidential, but the writer writes, I have bipolar disorder and am on Medicare. I feel like I have homicidal anger issues, which is a new symptom. I cannot afford the copay for counseling or to see my psychiatrist for a medical checkup. Are there public programs that would pay for this? I am not eligible for Medicaid. I make too much in Social Security disability. Congressman?
You've got to call your psychiatrist anyways. You can also go to an emergency room. Emergency rooms are required to treat you if you come in, and it is very important you talk to the doctors there. Ask to see a psychiatrist. Look, I'm having homicidal concerns right now. I suggest you do that now. It is extremely important. You cannot let that go by. Go to an emergency room as your first aspect there and talk to the people there. The same thing goes for people who have suicidal thoughts too. If you're thinking of suicide or in plan, you need to get to a hospital right away.
And we've got the number for the National Suicide Prevention Lifeline there on the screen, 1-800-273-TALK would be that number. I want to go now to Shirley from Palm Beach, Florida, a mental health professional. Shirley, thanks for joining us on the Washington Journal.
Hi, good morning. I worked in mental health. I worked in human services for around 20 years after I finished raising my family by myself, and 20 years of that was in psychiatric, in the hospitals, etc. And I myself suffer from depression. I found that I have allergies, and there's a book by a Dr. Mandel, Dr. Marshall Mandel, and he talks about how allergies can affect us so severely that they can cause things like depression, schizophrenia, hyperactivity, retardation, autism, even epilepsy, and many physical diseases like hives and hypertension and hypoglycemia, etc. And it's hard to say this because people look at me as if I'm crazy when I say, well, look at your diet. How many people believe that schizophrenia could be caused by your diet and things that you're allergic to? And
Congressman, get your thoughts.
Look, there's lots of things that go into this. Do people have food reactions and supplements or additives in foods that can affect them? Yes. As a cause of schizophrenia and autism, no. And I don't want people to continue to think that if only I change my diet, everything's going to go away. There's lots of other issues. There's genetic issues. There's environmental issues. There's many other aspects here. And I find
and
some.
could you give folks your background in these issues? Just
Well,
so
I'm
they
a
know?
psychologist by training and worked with this for 35, 40 years. And also work in the Navy Reserve as a psychologist. Believe me, it isn't just aspects of food. It is important to have a healthy diet. It is important to stay physically fit, to not be isolated, to have a healthy weight, etc. Those are all parts of helping you overcome depression and other aspects there. Now, we know when a person's isolated, a sedentary lifestyle, not eating healthy, a lot of those things can impact brain development. We know when a person's not sleeping correctly, those can affect a number of hormonal levels of the brain, which can worsen mental illness symptoms. But it isn't the only cause of that. It is part of a comprehensive evaluation. If you see a doctor, to look at a diet, exercise, sleep problems, family history, symptoms. All those are part. What we don't want to just do is say, here, take some medication, go home and call me in a few months. That's the wrong treatment. But combination of therapy, medication that's needed, looking at other lifestyle changes are all important parts of that.
Go ahead.
I was Shirley. Thank you for your call, and for raising children by yourself. Congratulations. That can cause depression too. I've raised 5, and let me tell you, there are times when I felt very depressed because my husband was not necessarily the best of parent to my children. I was the disciplinarian. But certainly a good diet will help you address some of the issues. And yes, there's clinical aspects of it that have to be taken care of. But generally, if you have a good diet and if you eat well and eat the right foods, you won't have as heavy of an impact in your ability to deal with these issues. Mm-hmm. That, to me, is part of it. So while it isn't the answer, it is one of the answers that I think we ought to start looking at.
It does help us deal with our stress response, you're right, and how we're managing these things. And you're right, as a single parent, a lot of these things can be overwhelming. And it does bring up the point, about 1 in 4 people sometime during every year will have a diagnosable mental emotional illness. Not to the level it's exacerbating. Sometimes it's a mild depression. Sometimes it's more than that. Sometimes it's anxiety and worry. But there are things that are in very many cases treatable.
Let's go to Joanne from Kingsville, Maryland on the Republican line. Joanne, you're on with the co-chairs of the Mental Health Caucus on Capitol Hill.
Oh, thank you for taking my call. Something that hasn't been discussed before is about medications, antidepressants, and the problems they themselves can cause. I've been depressed probably since a teenager, but was never medicated. But in 2000, I developed chronic pain that became pretty hard to deal with. And, of course, you know, I was upset and I would cry a lot. And my doctor says, oh, you're depressed. And they put me on Prozac. And then my pain doctor put me on dextromethorphan. Well, within 2 weeks, I developed a panic attack bad enough to be put in the hospital. And in there, you know, I said to the doctor, I said, you know, these 2 I've been put on recently. Could that be the problem? Oh, no. And their treatment for me was just to put me in a room and call me crazy.
Can I ask you a question on that? And I'm not trying to treat you clinically. But the physician who prescribed Prozac, was that a psychiatrist?
It was my primary care.
You know, I would oftentimes tell physicians, I've heard a psychiatrist once tell it to a cardiologist, he says, I won't do heart transplants, you don't treat mental illness. I understand what a doctor's trying to do when someone has chronic pain, and that can lead to some serious problems here, emotional problems too, because your brain, your system's getting overwhelmed by that. But if it's to level 2 where you're having those kind of concerns, it is important a person get the right mental health treatment from a person who's trained to do that, especially with psychiatric medications. You need to see a psychiatrist. And with regard to psychotherapy, just talking to someone or being put in a room or being told you need to get over that, that's not the right treatment. You need to see a psychologist, social worker, counselor, someone who's trained in these aspects.
Well, not only that, but look at all the ads selling all these kind of products. Oh, yeah. That then at the end, it used not to be, but now they're required to put in some of the possible after effects.
Side effects, yeah.
And the side effects. And that should be an awakener for everybody that takes any kind of medication, is to ensure that they know what they're doing.
Yeah, you've seen this before. You see someone takes one medication for one thing, then they take another medication for the side effects, another medication for the side effects of that, and it goes on until the person's taking several drugs every day.
And that's you become reliant on them.
Become reliant on them, and then if you stop taking them suddenly, you can end up with serious problems. If you smoke and take them or drink alcohol and take them, you can have serious problems. Whole host of issues.
Well, in the last minute we have here, I want to get each of you on how you keep these issues in the minds of your colleagues not just in the days after Newtown, but in the weeks and months coming?
Well, hopefully we'll be able to get together and work on being able to talk to the administration and find out what SAMHSA is going to do in bringing all these agencies together to find out how can we work at this level to begin to help people and put the funding that is necessary and actually get all these agencies that have these programs. What's going on is the money being effectively utilized at the local levels, which is where the problem is at the local level. It isn't here in Washington. We can talk and put all kinds of laws in effect, but if it isn't being taken care of at the local level, there we will have a problem. And being able to have enough information to be able to be informed and educated to if there are any laws that need to be passed, and more of education to our members of Congress to be aware that this happens in their backyard.
And I would just venture to say we need to continue this dialogue with members of Congress, the community, and I'll volunteer. We would both welcome a meeting with the President and to discuss these issues and have an important national forum what Congress can do as well.
Congressman Murphy, Congresswoman Napolitano, the co-chairs of the Mental Health Caucus, thanks for joining us.
Thank you so very much for bringing this up. Hope you'll do it again.
Up next, schools across the nation are taking a second look at safety procedures.